We're good to go. All right, if it's all right with the group, good afternoon. I am Louie and I will be your moderator for this session. I will be joined by Charles, who will help ensure a smooth flow for our breakout room. And I think we're missing out on Adriana, is supposed to be documenting our session, but since we're recorded, we'll be fine. Again, to everyone who has just joined us, we are in room 1, occupational therapy students. And for this session, we have 3 presentations. Each of our speakers have, as they said, a little less than 15 minutes to present, but they will get a little more than 5 minutes for questions and answers. So if you wish to ask a question, please type your questions through the Q&A box. We've seen that it is... Oh, Adriana is here. Thank you for acknowledging your presence. Please type your questions through the Q&A box. We've seen that this actually helps make sure that the questions are really understood well by the presenters. The Q&A tab is there on the right side of your screen. Please use the Q&A box rather than the chat box, so we may also be able to present your question on the stage. We will acknowledge your question, though. If you would like to ask a live question, just raise your hand and we will put you up on stage as well. So, for our first speaker for this session, she is a lecturer of the Occupational Therapy Department of the School of Health and Science at Fukuoka International University of Health and Welfare in Japan. The title of her presentation is Introduction for the Overseas Learning as a Mandatory Class Activity. And colleagues, I am honored to introduce Dr. Fusae Ishibashi of Japan.
Thank you, Louis. I think you have my video presentation. Could you please start my presentation? And because my presentation is so short and I speak, hopefully it takes like a 12 minutes, not 12 minutes.
Fusae Ishibashi.
Oh, thank you.
Are we good to go? Okay.
Speaking from Japan. Hello to everybody and hello Salaha. First of all, huge congratulations to the team Philippines. Under this turmoil situation, your effort to make this international platform must be hard. Congratulations, and I'm very honored to be here. Let me begin. Objectives. My topic is Introduction for the Overseas Learning as a Mandatory Class Activity, Part 2. Part 1 was reported in the first Asia-Pacific Occupational Therapy Symposium in Taiwan 2017. This previous report had discussed what the students learned and how they felt from their overseas experience. This part 2 would discuss the preparatory class activities before students departed to their destinations. Before I talk about class activities, let me briefly introduce this overseas mandatory class. The class title is International Circumstances of Health and Welfare. In 1999, this class had started as an elective class. In 2011, it converted to the mandatory class at some campuses. My university has 5 campuses in Japan, and my campus is one of them. where the class became mandatory. Since then, my university sent over 800 students, and they were dispatched 17 to 18 countries, regions for each year. The class objectives were to obtain the international knowledge of health and welfare and appreciate cultural differences through overseas experience. This is the example of overseas destinations and the numbers of students dispatched. Do you find your country? The number of students does not reflect the popularity, but the capacity of facilities for student volume to be accepted. Sadly, in 2020 and 2021, due to the COVID-19 pandemic, all overseas trips were cancelled. The class consists of two parts. One is 15 hours of lecture and 15 hours of group activity before the overseas trip. For the group activity, students were divided based on their destinations and studied further culture and lifestyle. Two is actual on-site experience. During the summer break, students are dispatched to their destinations and get hands-on experience. The duration of stay differ based upon the also destinations. Data collection. I obtained data from student course evaluation records. Because 2020 and 2021, the all trips were cancelled. This data was from 2019. From my campus, 240 students registered this class. Then, after students returned from trips, they were asked which topics, activities were useful and what needed more from their overseas experience. Result: 226 out of 240 students completed the course evaluation, and in overall, most of the students were satisfied with this class. Student evaluation for lecture. Most of the students stated lectures were somewhat helpful and helpful. The helpful lecture topics were health issues, communicable diseases, and food and water safety, multicultural manner, risk management, and student stories from the previous year. However, some students stated lectures needed more stress on following topics: health issues, communicable diseases, and food and water safety, student stories from the previous year, and local lifestyle such as rules and norms. For those topics, students also stated helpful, but they felt they needed further learning. evaluation for group activity. One of the group projects was further research for culture and lifestyle of the destination. Although the group consists of students from other departments, such as OT, physio, speech language, and medical technician, a sense of fellowship was developed through the collaborative tasks. On the other hand, students stated they wanted more time for liaison and cooperation with students on other campuses. Discussions. Students eager to learn the local lifestyle and listen stories, the first-hand experience of the student from the previous year. Grasping local health issues and norms make students picture the days at destinations. Also, because my university has 5 campuses, it will be the first time together as a whole IUHW group at the destination. It leads to difficulty to build the fellowship in a timely manner with students from other campuses. Student voice makes us realize the need to coordinate with other campuses before the trip. Conclusion. Jumping into the different cultural contexts and values could be stressful for the student. Although the class objective is to obtain the international knowledge of health and welfare, only preparing those knowledge is not good enough. For the successful learning, fostering students to adapt to different cultural contexts is vital, and lectures should cover those issues. This concludes my presentation. Thank you for your participation and looking forward to meeting you in person in the next APOTC in Sapporo, Japan. Maraming salamat.
Hi. So thank you, Dr. Ishibashi, for your presentation. We have actually more time for questions and answers. So are, if anyone would like to ask their questions now, this is the time for you to explore more about the topic. We have one from the group. So, what are the considerations in selecting the countries that the students will travel to? What do you foresee are the adjustments to be made in the post-pandemic normal to get back to this kind of program? So that's two questions actually.
Yeah, thank you for your questions. Uh, because the capacity of accepting student volume at the destination is not is limited. So selecting the student is, be honest with you, is based upon their GPA. So the study hard during their first year, they are easy to get the destinations they wanted to go. So it's kind of a sad story, but yeah, we selected based upon their GPA. So the next question is, well, that's tough question because it's we do not know for sure. Um, uh, the pandemic, post-pandemic normal. Well, I think we need to talk about more health issue before we send student to the overseas trip. But yeah, I That's the only uh, answer. Like that is my only answer right now. But Doctor, I'm sorry, who, Marita, you have any suggestions? I'm so glad if you give me some suggestions. I'm very welcome.
All right, thank you for that response. I hope it answered Dr. Maria's question.
Oh, if Maria can speak out, I'm very much honored to talk with her. Are you here? No, we are not allowed to do that.
She's here. She can actually do that.
Okay, but I think we have another question. So,
Okay,
right?
let's show that one first.
Hmm.
So from Professor Mendoza, do the students get funding from the university for this overseas learning activity?
No, no, they don't. But they are informed. They need a certain amount of money for the parent and the student. Actually, pay the whole money for the trip. Yeah, we don't have the funding culture.
Okay,
Thank you.
thank you. And we have another question here for you. This is from Bhing Leet. Well, me a comment. She just wants to say thank you IUHW for facilitating these visits. She mentioned earlier actually that the University of the Philippines, Manila, was also one of the partner institutions where that overseas exposure program um, was implemented, and I can't wait to experience that being a new member of the team. So hopefully soon we'll do something like that.
Yes, we're really looking forward to visit the overseas trip very much. Thank you.
All right. Dr. Santoso from Indonesia is also
Yes.
wanting to ask, how do you equip cultural competency for your students?
Okay. That's really tough for student as well as our the faculty member because it's just only listening and watching video were not good enough. So I think teaching isn't work. So actually, how to prepare for the student is the active learning. I think the group activity will prepare to what kind of life is waiting at oversee the other countries. That's active learning really prepare each one of the student. Did I ask you a question? Yeah.
I also posted the question there on the
Uh-huh.
stage in case you want to add to some more.
Competency. Well, I think I each of the students felt cultural differences. I asked her or him, why did feel it? Why? And what makes you such a question or uncomfortable or felt great? And I always ask my student, why did you feel that? That's, I think, foster my student and appreciate the culture difference as well as their own culture. They grow up, I mean, Japanese culture as well. Well, didn't I ask you a question, Louis?
That's actually not my question. I just got that question from the box, and Dr.
Oh,
Santoso from Indonesia actually asked that question.
thank you.
We had a lot to talk about in backstage, so I don't have a lot of questions.
Okay.
Yeah, and Dr. Santoso says thank you, Fusae.
Thank you.
Um, in the interest of time, I would like for us to proceed with the next speaker. But if there are any further questions later for Dr. Ishibashi, if we have sufficient time, and for everyone or all the other presenters as well, we would love to hear the questions and have an enriched discussion again. All right.
Thank you very much.
Okay. So, our second speaker is a professor of the Department of Occupational Therapy from the National Cheng Kung University, Tainan, Taiwan. She obtained a Doctor of Science degree from Boston University, and her research interests include motor performance of patients with Parkinson's disease, occupational therapy for patients with stroke, and research methods. Her presentation is entitled An Anti-Stigma Course for Occupational Therapy Students in Taiwan. Colleagues, I am honored to introduce Professor Imma of Taiwan, and she has a video for us to see. Would you like to share a few words, Dr. Ma?
Uh, Thank you for Louis' introduction. And yeah, just please play the video for us. Thank you. Ladies and gentlemen, my name is Imma from National Cheng Kung University in Taiwan. It is my honor to present my educational project named An Anti-Stigma Course for Occupational Therapy Students in Taiwan. Stigma can be understood as stereotype, prejudice, and discrimination towards people with devalued characteristics. Among the possible stigmatized attributes, physical disabilities, mental illness, and developmental problems are conditions that occupational therapists are likely to encounter during clinical practice. Attitudes of healthcare professionals toward these people and their families play a critical role in their motivation and intention to become involved in therapy. However, research has revealed mixed attitudes of healthcare professionals toward these populations, and some patients with mental illness even reported stigma-related experiences when interacting with healthcare professionals. Such experiences of stigma are likely to aggravate clients' feelings of rejection and incompetence, and thus are detrimental to clients' treatment seeking and ongoing participation in treatment. In addition, stigmatizing attitudes would also adversely affect practitioners' health and the development of therapeutic relationship, as well as the evaluation and intervention processes in our professional practice. Students entering the healthcare professions are also members of the general public who may share the public stigma rooted in our social cultural system. Therefore, the purpose of this study was to develop, implement, and evaluate an anti-stigma course based on context strategy and critical reflection for OT students. We hypothesized that the course would reduce stigmatizing attitude in students who complete the course. A quasi-experimental design was used to assess the outcome of the anti-stigma course. The course was named Exploration and Reflection on Healthcare Professional Relationship. It was set as a 2-credit elective course that lasted 18 weeks at National Cheng Kung University in Taiwan during the spring semester of 2018. We did pre-test, post-test, and follow-up test at 1 year later. We reviewed literature and did focus group interview to develop a course framework. The course proceeded from knowledge to experience and reflection and then to action. Multi-mode teaching approaches were used, including lecture, watching movies, and in-class discussion. In addition, students were required to participate in experiential activities involving social contact and role-playing and critical reflection. And finally, I have to do a action project. We also use the human library to recruit a person living with chronic schizophrenia to share his story and hold class discussions. The 3 group assignments were: first, accompanying a person with disability in the community. Second, role-playing a person with special characteristics and their caregivers in public. And the third project was the action project to promote friendly interaction with people with disorder disabilities, and students are required to write reflection essays based on the assignment. The social distance scale was used to measure one's willingness to participate in social contexts, entailing varying degrees of closeness with people with mental illness. It contains 7 items, with higher scores indicating great preference for social distance. Because OT primarily is concerned with people with mental illness and the physical and intellectual disabilities and children with emotional behavioral disorders. So we develop the questionnaires to evaluate stigmatizing attitudes toward these populations during the first year of this project. A 6-point Likert scale was used for all majors, with 1 indicating strongly disagree and 6 indicating strongly agree. A total of 15 students completed the course and the 1-year follow-up test, including 8 women students and 7 men students. Only 1 of them had suffered from physical or mental illness, and about half of them had family members or friends with disabilities. This figure shows the results of fragment tests on the pre-test, post-test, and the follow-up test for the social distance skills among students who completed the course. We see significant decrease from pre-test to post-test or follow-up in the items, and this means that the students were willing to get closer to people with mental illness after the course. We see the significant decrease in items. I would accept a person with mental illness as a neighbor, as a co-worker, as a friend, and accept them to rent my house. In addition, we see significant decreases from pre-test to post-test or follow-up in the item that I would recommend a person with mental illness for a job. I would accept a person with mental illness to take care of my child. However, we did not see a significant difference in the item. I would accept a person with mental illness as an in-law. For the questionnaires on stigmatizing attitudes, we also found significant decrease from pre-test to post-test or follow-up in the stigmatizing attitudes toward mental illness and toward children with emotional behavioral disorders, but not in the stigmatizing attitude toward disabilities. Occupational therapy interact with children and adults with various disorders and disabilities in their professional practice. While unique stigmas may be associated with different clinical populations, there are also commonalities between types. For that reason, the study's anti-stigma course began with a general knowledge about stigma and then used experiential activities and critical reflection to expand the focus to not only mental illness but also various disorder disabilities and their families and friends. By using the social distance scale and questionnaires on stigmatizing attitudes, we demonstrated that the course significantly reduced the stigmatizing attitudes that OT students held toward mental illness and emotional behavioral disorders. Moreover, we found that the effects remained 1 year later. We believe the combination of social contact, role-playing, and critical reflection strategies in this course has contributed to the decrease in stigmatizing attitudes of our students. For the social contact, students heard a personal testimony from a person recruited through the human library and also did the first assignment, that is accompanying individuals with disabilities to jointly perform activities chosen by that individual. Therefore, students had opportunities to fully interact with them as a full human being rather than merely viewing them in a clinical context. We also observed that the individuals with these disabilities choose activities that they were familiar with and competent in, for example, adaptive triathlon, and thus demonstrated their capabilities to the students. Based on their reflection essay, we found that this type of personal and positive contact helped counteract previous stereotypes and prejudices held against people with disabilities. For role-playing, we observed that some students experienced stress and anxiety about publicly role-playing a person with special characteristics, especially one with mental illness. We speculate that the stress and anxiety may have somehow reflected the difficulty associated with breaking the division between us and them. That is, we are normal people, so we cannot and will not behave abnormally like them. However, is it really true that we cannot or will not be abnormal one day? Critical reflection aids in deeper exploration of the given issues. By reflecting on their experiences, students became aware of their implicit stigma and the associated stigma. Such stigma-related feelings may be traced to shared public stigma rooted in society. The role-playing experiences may have also partly broken down the us-them division, as some students reported learning that stigma was not an issue confined to others, but may one day occur to them or their families and friends. For future research, continual refinement of the program, extension to other OT schools, and multidimensional outcome evaluations are needed, with a long-term goal to enhance the psychological well-being of both people with disability disorders and healthcare professionals, to deliver quality healthcare and to pursue health equality. And this is the end of my presentation. Thank you for your attention. Any questions or comments?
All right. Thank you, Dr. Ma, for your presentation. We have a little over 8 minutes for questions and answers for her, for what she had just shared. Let me just share that one. So I think the question is, were there any specific approaches or frameworks taught in this course that can be used to address issues on stigma?
This is a very good question. I think in our course, we only address, we mostly focus on the individual part. And I think to anti-stigma or to decrease stigma, we need a framework to adjust like 3-level framework from micro to meso and even to macro level to address stigma. And I think this is a kind of point with the concept of occupational justice. Because right now we are working on the next grant proposal. So I reviewed some literature and I think it's not easy or it's not, we cannot just reduce stigma in one course. We have to do it like maybe regularly or extend to a longer time interval. And I think, and even to different levels. And I think like occupational justice framework would be helpful or like empowerment model, because if we have this kind of model, then we can really enable and empower clients to be able to advocate for themselves. And this would be the most efficient way to reduce stigma. Did I answer the question?
I think she also would like to know what year level the students were when this was provided.
We provided the course to the second year college students,
All right.
and because at the same semester they have to take anatomy and physiology, and that's a very heavy course loading. So that's why you see not many students in the course. So from this semester, we move the class to the freshman, and then we can get like 40 students. Mhm.
All right. Do we have any further questions? Thank you for that response. I'd also like to, if in case there would be subsequent questions after this, um, the questions may still be posted on the Q&A. And again, if we have additional time later, we can still address the questions just so we can keep the ball rolling. And I think Dr. Ma has something to do a little later on. So hopefully we can hear more from her, from what she learned with her study.
Thank you.
Okay. Our third speaker for this session is the Program Director of the Occupational Therapy and Deputy Cluster Director of Health and Social Sciences at the Singapore Institute of Technology. Prior to this appointment, she served as the head of the Occupational Therapy Department at the Institute of Mental Health for 11 years. She graduated from the University of Queensland with a PhD in psychiatry and also has a master's in mental health from King's College London and BSc in occupational therapy from University of Exeter. Uh, she was accorded the National Day Award Commendation Medal in 2011 and National Healthcare Group Allied Health Educator Award Survey Senior Educator category in 2015. Her presentation's title is Occupational Therapy Students' Experience of Team-Based Learning, a Multi-Year Study. Colleagues, I am honored to introduce Dr. Bhing Leet of Singapore.
Hi, good afternoon. I think I have a recorded video presentation, and thank you, Louis, so much for the. My name is Bing Leet, and I'm an associate professor at the Singapore.
Oops, it disappeared.
Sorry.
Okay,
It's okay. It's okay.
Okay. My name is Bing Leet, and I'm an associate professor at the Singapore Institute of Technology, or SIT for short. My presentation is on occupational therapy students' experience of team-based learning, a multi-year study. This study has been published in the Journal of Occupational Therapy Education this year. These are the contents of my presentation. This is a typical team-based learning occupational therapy class in SIT. Team-based learning is a form of flipped classroom method, and as you can see here, students are actively engaged in discussions to answer questions instead of receiving information passively from faculty. This is our 4-year undergraduate occupational therapy program structure. In year 1, students receive a foundation knowledge in occupational therapy, and we gave a team-based learning teaser in the year 1 module. In year 2, students undertake 2 clinical modules, daily living skills and work and productivity. These 2 modules cover occupational therapy assessments and interventions for a range of neurological, orthopedics, and psychiatric conditions. In year 3, students undertake the play, school, and transition module, which cover occupational therapy interventions for children and adolescents. I will now run through the team-based learning process briefly. Before the start of the year 2 academic trimester, the instructor of daily living skills will put students into permanent teams. Before each team-based learning class, the faculty uploads reading materials and recorded lectures and students are expected to view the materials in preparation for the in-class Individual Readiness Assurance Test, or IRAT for short, and Team Readiness Assurance Test, or TRAT for short. IRATs are multiple choice questions administered individually. After that, the students will proceed to attempt the TRAT, which are the same MCQs, but students can now discuss with their teammates to arrive at a consensus. Upon completion of IRAT and TRAT, the teams proceed to review their performance and post questions to close their learning gaps. To clarify doubts, faculty can conduct a just-in-time lecture to address areas that are not clear. After establishing factual clinical knowledge in IRAT and TRAT, practical classes are scheduled to equip students with hands-on skills. The week then ends with a team-based case application class. During this class, students apply knowledge learned in IRAT-TRAT sessions to case studies. This is an example of a pre-class video that we have made. For the IRAT and TRAT, we use a web-based assessment system such that we can adjust the weightage of IRAT versus TRAT. We find that when students attempt questions by themselves and then with their classmates, the information is encoded and processed more deeply and made a deeper impression. This is a free web page that students post questions on to clarify IRAT or TRAT questions that they do not understand, or ask anything within the pre-class materials. This is a photo of a team-based case application class. Case studies are clinical scenarios developed by faculty to challenge students' clinical reasoning across the spectrum of care. For each stage of treatment, the students select possible options and they have to hold up their flashcards at the same time. Faculty would then go around to ask, why do you choose F and not B and C, for example? Hence, this generates discussions on the thought process behind clinical reasoning and encourages students to think deeper. When we first started to deliver the clinical modules using team-based learning, we decided to do a study for the first 2 cohorts. This is because studies in medical sciences disciplines have shown that there is increased classroom participation and learner satisfaction. On the other hand, studies on team-based learning in occupational therapy education showed mixed results, with a lack of mixed method studies. Therefore, our aim is to understand local occupational therapy students' experience of team-based learning. And our objectives are to explore students' perceptions and experiences of team-based learning, to capture changes in students' perception of team-based learning as they progress through the 3 team-based learning clinical modules, and to explore relationships between students' perceptions of team-based learning and their academic performance as measured by their module results. This was a mixed methods prospective cohort studies. Students from academic year 2016 and 2017 completed an online survey which was administered at the end of the first clinical module, Daily Living Skills, and at the end of the 3rd clinical module, Play, School and Transition. The online survey consisted of the team-based learning student assessment instrument and open-ended questions to obtain qualitative information on learning experience. The Team-Based Learning Student Assessment Instrument, or TBL-SAI for short, is a 33-item instrument with the sub-skills of accountability, preference for lecture or team-based learning, and student satisfaction. For the qualitative component, the phenomenology approach was used. We asked which aspects of team-based learning are the most useful and the least useful. And we ask students to suggest other modes of delivery that may be suitable. We also get students to describe their experience of peer evaluation. I shall now move on to the results. 127 occupational therapy students from both cohorts had full data for baseline and final survey, and their data was analyzed. In terms of age, numbers of years worked, and prior education, there were no baseline differences between the 2 cohorts. These were their mean scores. As you can see, the mean scores of all the subscales at baseline and final survey were all above the neutral cutoff, showing that there were positive accountability, preference for team-based learning, and student satisfaction. Collectively, there were no statistically significant changes in TBL SAI scores between the baseline and final evaluation. However, for the 2016 cohort, PET-T tests showed significant reduction in TBL SAI composite score at the end of the third module. However, this cohort's final composite score was still higher than neutral. Next, we found no statistically significant associations between TBL SAI scores and module results for the 127 students. However, among the 2017 cohort after the first module, Spearman's row showed a positive moderate association between their accountability sub-skill scores and their module results, meaning that students who were more accountable in team-based learning had better academic performance. Analysis of the qualitative data generated 4 themes, namely the power of discussion, time use, change in learning process and outcomes, and tailoring aspects of TBL to enhance learning. The first theme was the power of discussion. Majority of the students highlighted the importance of peer discussions in team-based learning, which provided them opportunities to develop their analytical and communication skills. This is one of the quotes by a student. Students also noted the importance of team dynamics in team-based learning group discussions. Some students appreciated working with diverse team members. One student wrote, "I like that everyone is mixed together, so it's a chance to work with new people." Others shared difficulties working with teammates who were less engaged, as seen in this quote below. Other challenges included the struggle to reconcile different opinions, as well as feelings of uncertainty regarding learning the correct information and concepts through discussions. The next theme is time use and was mentioned by 54 students. Some students stated that the overall time taken for a team-based learning class was too long. On the other hand, a small number of students said they prefer longer sessions. The pace of lesson progression was perceived as too fast for some and too slow for others. The third theme was change in learning process and outcome. Team-based learning changed the way in which students learn and engage in class. And these students said, "I think this is pretty good as it forces us to gain some knowledge before coming, and also using Stormboard to get questions from the students is good, as more people will be willing to ask questions." Students voiced out several positive outcomes, such as better awareness of learning blind spots, deeper understanding of learning content, and increased ability to consolidate learning. Learning was also perceived as more fun. The last theme was tailoring aspects of team-based learning to enhance learning. Some students reported they preferred group sizes to be smaller. Other suggestions included incorporating discussion during the question and answer segment and rotating teammates. Some students reported that team-based learning was beneficial and did not see the need for changes. Moving on to discussion, we found a positive moderate correlation between the 2017 cohorts of accountability sub-skill scores and their first module results. Studies on improvement in module results through team-based learning have been mixed. However, in our thematic analysis, students shared that when teammates were accountable and came prepared for productive discussions, they were able to clarify doubts, and team-based learning was then able to impact upon their learning process and outcome. In occupational therapy practice, clinical reasoning often involves the complex process of weighing and prioritizing different factors within a practice framework. Therefore, it is important for faculty to coach students to be more self-reflective and less reliant on faculty for content knowledge. Our analysis also showed that some students found the discussions too long, whereas others found them too short. It does take skills and patience for faculty to meet the differing needs of students, which may include being skillful in time management and reinforcing pertinent information after students have finished their discussions. Faculty will also need to spend time and effort to counsel students who are less prepared for classes and to encourage competent students to explain concepts to weaker students during discussions. Moving on to study limitations. We were unable to carry out a randomized experimental study because we needed to have equitable learning outcomes across the cohorts. We also know that module results is not the only way to measure learning. More robust study designs to investigate team-based learning's effectiveness in achieving learning outcomes may be worthwhile. In addition, our open-ended questions were developed based on literature and were not content validated by expert panel. Hence, adding focus groups might have yielded more insights and provided triangulation to the answers from the open-ended questions. Lastly, it will be useful for future studies to inquire into faculty's experiences and confidence in delivering team-based learning. In conclusion, occupational therapy students' perceptions of team-based learning in the areas of accountability, satisfaction, and preference for team-based learning appeared to be positive. Students valued the opportunity to think deeper and learn from peers. They also found that team-based learning changed their learning process and made lessons more fun. In summary, team-based learning may be a suitable method to aid students' learning of clinical occupational therapy knowledge. These are my acknowledgements. These are the references. And I would like to thank these two cohorts of students who participated in the study. Thank you.
Thank you, Associate Professor Tan, for your presentation. Now we have time for questions. We'd just like to also mention that to our Filipino colleagues, the Department of Occupational Therapy of the University of the Philippines, Manila, would like to share with you a needs assessment survey for postgraduate occupational therapy program development. The link may be found in the chat box.
And also for the participants who just entered the room, I have posted the links to the full text publication of this research study in the chat box. So feel free to access, it's free access.
There. I hope I hope also that the participants are able to access that one. Thank you, Dr. Associate Professor Tan, for this one.
I just also want to add that this is a very new undergraduate occupational therapy program. We did this study on our pioneer cohort and our second cohort. So this is something that is entirely new to us. It's a new experience, and but we managed to collect 2 years worth of data.
Also from well, this one is related to what to the presentation of Dr. Ma earlier. From Professor Teresita Mendoza, a very good program for OT students to prevent stigma among students and towards their clients. I just typed it there so we can show it to everyone. There's a question I was sent privately, but Associate Professor Dan, would you like to mention the other members of the team who did the study with you?
Yes, in the research team, we have got 2 other members who are also occupational therapy faculty. So one is still teaching in the occupational therapy program and involved in the team-based learning. And the other one was also involved in delivering the team-based learning module, but she's now working in the research institute. We also have got our admin colleagues who help us in terms of the administration of the programs, and they were stated in the acknowledgement page.
And the respondents are all occupational therapy students?
Yes, these are the year 2 at baseline, and then at the post-intervention, they were already in year 3. So these are all occupational therapy students. We had a total of 127 students who completed both the baseline as well as the post-survey.
Okay, thank you for those. I think maybe some of our the colleagues here are interested in knowing how they might be able to use that in their own settings as well.
Yeah, the team-based learning method is now quite popular among the health sciences, and
It
in some
is.
occupational therapy program, it has been adopted. Some programs actually use it together with problem-based learning method because both are flipped classroom methods. And in the medical schools here in Singapore, the schools have also been using the team-based learning method because of the efficiency in delivering the program contents and also the application of the concept. So it sort of reduces the time on giving passive information and encourages students to be involved in active learning instead.
So as a result of the study, do you use team-based learning as a teaching strategy in your other OT courses?
Right now, we only run an undergraduate occupational therapy program. We do not have a postgraduate occupational therapy program yet. In some other allied health programs, such as physiotherapy, they have actually started using team-based learning also. So it is, so far we have used it for a total of 4 modules within our undergraduate occupational therapy program, and we are still continuing to do that.
A comment from Miss Arden Panotes. She's curious about how the faculty or the team facilitators were trained or oriented before the implementation of the team-based learning.
Yeah, that's a good question. Thanks for the question. We have a teaching and learning division, and this division actually ran a workshop to coach our faculty and instructors in delivering team-based learning. I think subsequently there were also some community of practice that allows faculty to pick up skills in team-based learning. However, I think as stated in our study limitation, because it was a new program at that point in time. So although we went through some training, it was at least for the baseline, the first module, we did that for the first time. So therefore, I think it did take skills and also some level of patience to deliver team-based learning, because actually there is a much more work than didactic teaching. You have to do a lot of work beforehand and you have to facilitate the learning among students.
Thank you for those responses. Would anyone else want to ask questions? I'd also like to highlight a link that was shared by Dr. Ma. This link may be found on the chat box as well. There's another one that she shared. Both are from her, and both are also uh, both are results or articles about the studies that she made, the papers that she published. Do we have any other questions for our speakers today? I think we can all be in agreement that these are very good strategies that we have just heard about, and I think we are all looking forward to apply more of these strategies in our own teaching contexts. I'm not sure if you were also asked. I'm just going to highlight this other comment made in the chat box. Thank you for this presentation, Ms. Tan. I find this teaching strategy very interesting as an OT student and hope that we could try this out here in the Philippines.
Thank you very much for this comment. I think it would be really nice to hear from other instructors and faculty within this region who are going to try out team-based learning or who have been implementing team-based learning. I think it would be really nice to exchange notes and to have a conversation on this.
Thank you for the thank you for the comment, Patricia.
Okay, so we can catch up actually after this.
All right. I just like to mention. Well, we have another host that would like to mention briefly regarding the activities for tomorrow before we end this session here. If Miss Monteagudo would like to do the honors. Okay. She's saying that the it's noisy in her background, but she will momentarily share with us the details, which I am not very familiar with. Okay. While we're waiting for that, and while we're waiting for further questions, I'd also like to just go over a few things we would like to share to the group. So, the Philippine Academy of Occupational Therapists and Learning Ablers present these certificates of appreciation to Fusae Ishibashi, Imma, and Bhing Leet for being an oral presenter during the 7th Asia Pacific Occupational Therapy Congress, hosted by the Philippines via AirMeet on November 22nd, 2021, signed by Roland Lyle, Duque, and Arcil Rosario Gozon, co-conveners, and Dr. Anthony Gresha, President of the Philippine Academy of Occupational Therapists.
Thank you very
Thank
much.
you.
And so, we still don't have the details. I believe we would be okay. There now we're ready with the announcement.
Okay. Good afternoon, everyone. I hope you had a very enriching first day of the conference. We just wanted to remind everyone that our sessions tomorrow will start at 9 a.m. for the plenary session. So be right on time because, as you noticed earlier, we started on time because we are going to have some problems with time management over the next few hours if we start a bit late. Okay, so um, I, I'm just gonna turn over the mic and stage to Louis again. I just wanted to remind everyone about the session start tomorrow, and that you are also free to join the other parallel sessions in the morning and in the afternoon tomorrow. Thank you very much for joining us.
Thank you, everyone, for attending this breakout session. We hope to see you again tomorrow for more of the Asia Pacific Occupational Therapy Congress. This has been Louis with Charles and Adriana. You saw Carissa. Um, if there are other plenary sessions open, I believe we are all welcome to join them as well. And we wish for you all to have a wonderful rest of the day and a great week ahead. Arigato gozaimashita. Is that right?
Yeah, your pronunciation is perfect. Thank you very much.
I will work on that for 2024.
Yes, we're waiting for. Thank you.
We'll all pick up our Japanese for the next 2 years.
Yeah, I really hope we can meet in person. But I think this is great platform. This is my first time to use a Air Meet, but it's so easy to access and so many functions. I'm so impressed. Congratulations again. You Team Philippines has a great, wonderful jobs, and you are a role model for the next Congress. Thank you very much.
Thank you on behalf of the Philippine Academy of Occupational Therapists.
Thank you also for making all these adjustments amidst the pandemic period.
Well, let's hope that in 2024 we can just go there and
Yeah.
meet each other in person.
We're hoping it's a face-to-face conference.
Yes, yes. And we'll have lots of sake there.
Yes.
Maybe.
Yeah, you count on it.
Okay.
Yes.
Our hosts will be closing the session, and so we hope to see you in the other breakout rooms. Thank
Thank you
you.
again.
Thank
Bye.
you.
Bye.
Thank you.